to make the start on tonight's Dairy Woman Island meeting.
Okay, thanks, Linaire. Hopefully my technology is working. Yep. And that you can see my slides. I'm Mella McCoy. I work with Animal Health Ireland for the last 4 years, and before that I was working in practice in a number of places. We are also joined by Finola McCoy, who also works in Animal Health Ireland. She's there since the beginning, so we're delighted to have her with us tonight because she's a fountain of knowledge in this area of drying off. And also we have Mella Briscoe, who I have had the opportunity to get to know in the last year or so. She's a very interesting lady and a great farmer, and we're really looking forward to having her participation and telling us how she does the drying off and in terms of preparation and before the dry period, what she does on the day and how she deals with the dry period. So it's I think it'll be a very interesting evening. I know it's a busy time of year and there are lots of other topics going on in the background. So hopefully for this hour or so, we can just focus on drying off. It's good to remember that it's a very important time of the year for the cow and the person. And we like to think of it not as the last job of the year, but the first job of next year, because how this event goes, it determines the next lactation, and we'll explain why throughout the meeting. So Finola and I are going to share the first few slides, then we'll bring in Mella to go through her approach step by step, and we're happy to take questions throughout, whether you want to raise your hand or type it in if you prefer to do it that way. I think the more interaction we have, the better for everyone. And just to remind you all that this is being recorded. So I'll hand over to Finola if that's okay. Are you able to see the slides, Finola?
Yeah, perfect. Thanks, Michelle. Thank you to Dairy Women Ireland for the invite to speak tonight. As Michelle said, we're going to do a little bit of a double act. I have to give Michelle full credit for preparing all of the material. I'm just piggybacking on her hard work. So we are going to and fro. And as she said, if there are any questions either along the way, things that prompt conversation, by all means, just interrupt. It adds to the discussion if there are relevant questions at the time. I also don't want to teach my granny how to suck eggs, and I know a lot of this. You're going to know a lot of this. It's some of this is I suppose our tasks or jobs that you've been doing for a long time. And I just maybe want to take a step back and just refresh perhaps some of the key pointers or the reasons why we focus on this so much, because I think if we understand some of the rationale, it can make more sense as to why the recommendations then come about. As Michelle mentioned, the dry period is a really important time. And if we consider why, it's an opportunity for the cow. It's the time when she can correct her body condition score for the next calving. So depending on how things have gone over this lactation, she has 6 to 8 weeks to get herself in the best body condition for the next season. It's also a time for the udder to involute and then regenerate. So whether there have been challenges or not throughout the previous lactation, it's important that udder gets a rest, because if it doesn't, then it doesn't reach peak yield the following lactation. So it's really important that it gets a break, and it gets time for the tissue. The tissue actually disappears and regenerates. So involution of the udder is when the intramammary tissue and the cells essentially degrade or disappear slowly, and they're replaced and regenerated. So it's actually full, replacement of the udder cells, which is really important for milk production. And it's also relating to the udder, the time when we get the best cure rates from existing infections. So we're all probably familiar with, we kind of throw about numbers around cure rates, and we talk about certain pathogens having only a 20 to 50% cure rate. In other words, if we have, for Staph aureus, for example, if we have 10 cows that are infected with Staph aureus, if we try and treat them during the lactation, a cure rate of 20 to 50% means at best we'll cure 5 of them. At worst, we'll only cure 2. So that means that there could be 8 of them still infected, or at best maybe 5 of them still infected. That's if we treat them during the lactation. But if we treat them correctly and appropriately at the end of lactation and then give them a good, a dry period to follow on, we increase that cure rate to 80%. So in other words, we're now aiming and expecting to cure 8 of them, leaving only 2, or I suppose failing, if you like, or not being successful with 2 of them. So it's a significant difference in terms of how successful and our appropriate use of antibiotic. Having said that, there are always cases that, we're never going to cure even at the dry period. And we'll probably talk about that in a little bit more detail if we've time towards the end. It's not just about the cow, though. It's also, and this is really important, it's an opportunity for the farmer and for the milkers to have a break, both physically and mentally. It's not to be underestimated, I suppose, and again, I'm not, here's a point where I'm not going to teach my granny how to suck eggs. You know what the mental and physical challenge of the full lactation and the preceding year is in any particular year. So to have the opportunity to have a physical and mental break and to prepare for the next season is really, really important. Michelle, we'll skip on to the next one, please. Having said all that and looking at the positives and the opportunities, there are also risks with both drying off and the dry period. So what we can see here, this particular graph just looks at the times of the dry period and coming up to calving when the cow is most at risk of getting a new infection. So the time scale is along the bottom there. 0 is the point of drying off. And the cow is most at risk of getting a new infection in those first 2 weeks or 14 days. And the reason for that is her teat canals, they can take 2 to 4 weeks to close properly. Can be quite a bit of variation, but generally they can still be open. They can still be open for 10 to 14 days in most cases. So the teat canal is still open, and if the teat canal is open, the bacteria can potentially get into the udder. The other challenges that the cow is going through are changes, physiological changes. Milking has stopped, so she has to adjust to that. Feeding may also have been adjusted. She has to adjust to that. So there are a lot of changes, both physically and from a physiological perspective, that are going on, as well as this potential challenge from bacteria. The other time that she's most at risk are the last 2 weeks before calving and then immediately post-calving. And again, the reason for this risk period are the teat canals are conversely, they're starting to open up again in some animals, and you'll see this with cows perhaps running milk before calving. In some animals, the teat canals can actually open, some time before calving. Thereby, if the door is open, bacteria can get in. The other challenges that she's going through, late pregnancy, hormonal changes, perhaps being off feed, all of these things can have an impact on her immune system. So again, if there's an opportunity or an easier way for those bacteria to get in through that open teat canal, the cow's immune system may not be as robust or as able to defend and to get rid of those bacteria as it may normally. So that's another risk period in the lead up to calving and just immediately after it. And you'll see in addition to that there, what's kind of labeled as that vulnerable period. The reason this is particularly important and even more vulnerable is because no matter what product we use, when we're talking about antibiotic treatment at drying off, if we give a cow an antibiotic dry cow tube at drying off for whatever reason, that will have disappeared from our system by the time we get to the end of the dry period. Therefore, she doesn't even necessarily have antibiotic to give her that added protection. So that's an additional vulnerable period in that time before calving. We have to, when we have to be particularly cognizant of. The other point to remember, and Michelle already mentioned this, and clearly made the statement that drying off we should think about it as the first job of next year and not the last job of this year. Because what we do now starts off next year and it sets the bar for next lactation. And the reason we see that, or the reason we can say that, is because research shows us and tells us that 50% of the new infections, so the new clinical mastitis cases that we see next year at calving time and in early lactation, 50% of those will have originated from drying off or the dry period. So if they originated 6 to 8 weeks before they actually appear, there's not much we can do about them once they've appeared. So what we need to do is be prepared 6 to 8 weeks earlier and try and make sure they don't get established in the first place. The reason this can happen is because The bacteria, as I said already, the first 14 days, teat canals can still be open or are often still open, and the bacteria get in easily. Those bacteria can multiply enough to establish, but not necessarily to develop into any, I suppose, any obvious infection or with clinical signs. What happens over the course of the dry period is that the lactoferrin levels in the dry udder are very high. Lactoferrin is a natural molecule. It's in very high levels in the dry udder, and what it does is it binds up iron. And if there's no available iron, then the bacteria can't multiply. So that lactoferrin, if you like, is kind of like it prevents the bacteria thriving. It doesn't kill them, but it just stops them multiplying any further and developing. But once that dry udder starts to regenerate and then bag up again, basically, and prepare for the next lactation, the lactoferrin levels drop off. Once that lactoferrin drops, the available iron starts to increase. So now the bacteria have the perfect environment. They're warm, they're protected, they have nutrition, and they have plenty of iron. So they now can multiply and thrive, and that's why we often don't see those infections often don't present until the point of calving or soon after calving in the very early lactation. So it's just, I suppose, important to remember sometimes, if we see cases in early lactation or around calving, and we might be, fixated on, or not fixated, but we might be focusing really on what we're doing around the calving time and how we can improve or how we can correct things. And yes, that's really important because that could be one of the times that they become exposed to the bacteria. But we also need to bear in mind that it may actually be a reflection of what happened 6 or 8 weeks ago when we dried them off, or particularly during that early dry period. So the connection, I suppose it's an important connection to make, that when we dry them off, it doesn't just break things and reset the clock. It is, in fact, the start of our next season or our next year. Michelle, do you want to move on there? One more there, please. Thank you. Okay. So I know we're probably all, I suppose we can't but be aware of new regulations that have come in, that came in 2022 in relation to how we use antimicrobials or antibiotics, and particularly how we're expected to use them around drying off. Again, we'll come to that with more detail. But I think we also need to take a step back from that because there are some fundamentals and some basic principles around drying off and dry period management that if we don't get them right, the conversation around treatment or antibiotic or not, or what kind of antibiotic is somewhat irrelevant. We need to have the basics and the fundamentals in place to have a successful drying off. That will also influence our ability to successfully change our practices and change our behaviors around the type of dry cow strategies that we develop. Without having the foundation in place, then our choices around antimicrobial use and cow selection and so on are kind of, I won't say they're doomed, but they're going to be an awful lot more challenging and an awful lot riskier. So there are some fundamentals and some basics that really we can focus on and should be focusing on, regardless of our treatment choices. And they're quite simple. Firstly, best practice on hygiene at drying off. So what actually happens in the process of drying off? Secondly, the winter housing management. And again, going back to that graph where the key risk times were the very start and the very end of the dry period, but also what happens during the dry period will determine, the level of challenge or the level of exposure for a cow in terms of bacteria. Thirdly, the importance of having good records. We need good records for multiple reasons. One is to be able to have those conversations around treatment choices and to understand what's appropriate treatment or how do we select cows that may or may not need antibiotic treatment. But also having the records early enough next season and following on with records so we can then look back and say, okay, I made these decisions for dry period 2023. Spring 24 comes around. How successful were they? How appropriate were they? And how well did I manage or how well did I prevent new infections over the dry period? Without records, we're guessing. And in some cases, sometimes when I talk to farmers, and sometimes they can be a little bit disappointed or frustrated perhaps by what they feel are the outcomes from the dry period. But then when we actually sit down and look at the records and quantify the achievements, it's actually, they're actually perhaps more focused on some of the I suppose the hiccups or the problems that will inevitably always happen, but that in general the success or the outcome has been very, very successful. But again, we need records to be able to quantify that. And then finally, as I mentioned them already, the new veterinary regulations. So there are new veterinary regulations in place which determine how vets can now prescribe. And this is particularly relevant for the dry period because it relates very much to I suppose preventing or it no longer allows the preventative use of antibiotic, which, let's be upfront about it, was one of the 2 reasons that we have always used antibiotic dry cow treatment. If we ever held workshops in the past with people and asked them, why do we give antibiotic dry cow treatment? The 2 reasons that we were looking for was, 1, to treat existing infections, and secondly, to prevent new ones. And for a long time, I suppose as an industry and globally, we have recommended that as good practice. If we go back to the 5-point plan from the 60s, which was developed in the UK, one of those 5 points was blanket dry cow therapy, because it has always been considered good practice. However, the science has changed, society has changed, and it's no longer considered acceptable to use antibiotic to prevent infection. It's not debating that it's not effective. It's just not an acceptable option anymore. So we need to think differently about how we use that antibiotic. And I suppose the nub of thinking differently is we need to be really focused and sure that our hygiene and our management are the best. And in doing that, then everything else is possible. Michelle, I think I'm probably handing over to you at this point.
Yeah. Thanks, Finola. We'll come back to you for the tricky bit again in the minute about the regulations. So when we're giving trainings to vets and developing resources for farmers, we try and make our messages kind of as simple as possible and break it down as much as we can. So for drying off, and I know I had a call with Mella before this meeting just to kind of, prepare a bit, and she's very impressive how she does all these things. So it's great. We're going to tell you what we want you to do, and Mella will come on in a minute and reinforce our messages, hopefully. So we break it down into preparing before drying off, then we'll go through what to do on the day of drying off, and then after drying off and at the start of next lactation, what the kind of key important things are to do. So really, and I know before probably people might decide on the morning that they were going to dry off cows and just do it without much thought put into it. But really it should, preparation needs to start up to a month in advance, really, especially now, as Finola mentioned there about antibiotics no longer being allowed to be used preventively. We need to focus more on management and have better attention to detail. So I suppose the first thing is to plan your final milk recording, and even if you haven't ever milk recorded, there's still time to do one before drying off, and this will give you huge information about kind of what kind of level of infection is in your herd and what cows will need or may need an antibiotic. So the more information we have at drying off, the better the event will go. It's all about risk, really, and so the less risk there is, the better outcome we'll have. And one of the ways of reducing the risk is having information on individual cows, and milk recording is the most practical and easiest way to do this. So it also, ICBF have huge resources and records. So hopefully, if you're not already a member of ICBF, then do try and join up. You will be surprised at how much information there is available there. And this will follow on then. Like at Animal Health Ireland, there is a dry cow consult available to those who meet the eligibility criteria. And so the eligibility criteria I'll go through in a bit more detail, but basically it is if you have done 4 milk recordings and you have a bulk tank SCC below 200,000 for the year. But not to turn you off if you're not reaching those criteria, we have another consult available to you to help manage your mastitis or SCC. So I will, as I said, I'll go through those a bit more in detail in a minute. So it's important to get your vet on board, to go through records during this consult. That's part of the consult. Before the vet goes out, they'll assess your milk records. They'll ask you to have your clinical cases available, and if they've done any if there's any lab results available, then all this information is very important to help the vet identify the cows that need a dry cow antibiotic. So I suppose, like, some cows still need a dry cow antibiotic, and it's important to identify those correctly. There's, as Finola mentioned, there's a lot of talk about what SCC threshold you should be choosing your cows for selective dry cow at, and this is kind of, it's down to a discussion with your vet as they do the prescribing, and it's important to have that discussion and use the supports available to help have a successful outcome. Another job that should be done in advance of drying off is adjusting the diet to manage the milk yield. I suppose this is more if the cows are very high yielders and you need to reduce their milk yield before drying off. It's recommended that that's reduced down to around 12 or 14 litres per day. Higher, if they're milking more than this at drying off, it does increase the risk. So calving dates, Finola mentioned that they need around 8 weeks of a dry period, and even sometimes even longer for a thin cow or a young heifer. So it's important to review your calving dates with some sires. You know, the calving the gestation period is shorter than it was before, so it's important that the cow gets enough time dry. Clipping tails and udders is another way to minimize the risk of contamination and ensure that the udder is as clean as possible when doing drying off. Checking the dry cow housing, it's important to have this done before the cows come in to make sure the cubicles are in good repair. Mats, you know, sometimes if they're cracked or not fitted properly, they're harder to keep clean, and bacteria can build up, and again that increases the risk of a cow picking up an infection around or during the dry period. So these are all things that shouldn't be left to the last minute, and I know at the moment the weather isn't great and cows are being housed earlier than we'd like, so the time is kind of running out. I suppose we should mention that we have developed videos and they're available on the AHI website. There's one particular one by Don Crowley which kind of highlights kind of little jobs that can be done. Like, we realize obviously this time of year you're not going to go build a new house if you don't have enough cubicles, but there's kind of small jobs that can make it possible to house the cows in a better and less risky environment. So we would encourage you to look at that at some stage if you can. And there's loads of other resources as well, which we'll mention as we go on. So then on the day of drying off, really it's again about preparation, and we can't emphasize enough how important attention to detail is, and having the correct equipment, having enough help. It is a tedious job. Ideally we want a couple of people doing it, and I know Mella will outline her routine, and it's a very good and efficient one and interesting. And again, as I say, we all learn. It's good to hear different stories because you pick up new tips every time. If you can, try and do drying off when the weather is dry, because when it's wet, it could be drops of dirty water dripping off the cow and onto your gloves or your hands when you're trying to do it in a hygienic manner. It's just easier to do it on a dry morning or afternoon. The next point there is, you might think I'm joking, but you need to have had something to eat and not be hungry or not be thinking about other jobs. This is a very important job that needs to be taken seriously, and you need to be in the frame of mind for doing it. with the move away from blanket dry cow therapy. It is a big behavior change, and it is normal for people to be nervous about changing it. We have a psychologist working with us now in Animal Health Ireland, and she tries to help us get our messages across. And one of the messages is that it is normal to be apprehensive, but there are things that you can do to help allay the fears, and one of those is preparation. The equipment, headlight is important. It can be dark in parlours and difficult to see. The teat ends, cotton wool or wipes that come with the teat sealer or dry cow tubes, and surgical spurts is important, or is another, like, so a lot of people would soak cotton wool in surgical spurts, and then after cleaning the teats would sterilize the teat ends with these. I know before it was methylated spurts was recommended, but we've moved away from recommending methylated spurts in the last couple of years, just because the consistency of the product isn't always what it says it is. But surgical spurts is always 70% alcohol, which gives a better sterilization, and people are used to using surgical spurts because that's since COVID, any of the hand sanitizers, they're all made up of surgical spurts. So it's important to mark the cows and record what treatments they've been given, and ideally record these online as well, whether it's on your farm app or ICBF. It will make it easier going forward and in the following lactation to see how your dry event went. And I know Mella will mention this, but she picks her cows. She just does teat seal only on one day, or cows that need antibiotics on a separate day. I think that's a great idea. It prevents any mix-up going on. So we'll hear from her in a minute. Again, hygiene. It's all about hygiene and attention to detail. Like, everyone has different levels of hygiene, and this is one of the tricky messages to get across, how hygienic you have to be. But I think a good way of thinking about it is, you've all seen a vet carry out a cesarean section, and like they do about 3 or 4 cleaning routines. They do with an iodine or chlorhexidine, and then a couple of spurts before, and they examining the cotton wool to make sure that there's no dirt left on it before they're happy that it's sterilized. And that really is the level of hygiene we're talking about when we're talking about hygiene. But that's not easy to achieve in a parlour situation when you have a dirty tail or a tail swinging in front of you, and the cow doesn't like you being at her. So I'm not saying it's easy, but I'm just saying you need to have the procedures in place to make it as least risky as possible. A lot of the stories we hear, if we hear some stories that it hasn't gone well, and it's down to sometimes people try and do too many cows at one time. And really the most that we would recommend doing at one time would be 20 per person. After that, your hand gets tired. Like, it is very hard to push out the teat seal, and you kind of lose, you get tired yourself, and you lose concentration. And the aim should be to do the last cow as well as the first. So really there is a limit to the amount you can be doing at one time. Then it's important to teat spray after, and to stand the cow in a dry area for up to an hour. I suppose whether you house her then, or if the weather was good, it might be better to leave her out in a dry field. But that's not to say you don't look at her every day, a couple of times a day, especially at the beginning. It is the cow. There's a lot of changes going on for the cow, as Finola mentioned. So it's important to monitor closely at these times. And then after drying off and during the dry period, it's all about managing the dry cow environment. we cannot overemphasize the importance of this, having enough cubicles and keeping them clean. Really, it's recommended that you have, for 100 cows, you'd need 110 cubicles. And you might think this is a lot, but it's what research has shown to, it's what the cow needs to express her natural behavior. If she's under pressure in any way, it will suppress her immune system and increase the risk of her picking up mastitis. She could also be bullied if there isn't enough room, or if she doesn't have enough access, say, for example, to a water truck. There should be at least one water truck per 50 cows with 2 access points to the water truck. Sometimes if you have a bully of a cow and there's only one way to access the water truck, they can block off the water truck, and so some cows might never get access to water. So these are just some of the reasons why it's important to have enough cubicles and resources, feeding space available for the cows. We did develop a housing checklist a couple of years ago, and the aim of this was, I suppose it's hard for anyone to tell. Nobody wants to hear that their houses are dirty or their cows are dirty. So this was kind of a way of introducing the topic between farmers and advisors or vets. But it also could be useful for you if you have staff and you want to train them on the level of hygienes that are necessary during the dry period, how clean the cubicles need to be, how clean the cows need to be. It's color coded, so it's very easy to use. It's a tick box exercise. So if your answers are all in the green section, then obviously that's very good. But if they're in the red, then there are many areas which can be improved on. And as I say, it might be useful if you are trying to train your staff, or have the conversation with your other people working with you. Might even be staff, could be your partner, which they mightn't have the same hygiene levels as you do. So we mentioned about milk recording. It's important to have one before drying off, but it's also important to have one early in the next lactation. This allows you to assess how your dry period went in terms of cure rates, or if there were new infections picked up. But you'd have to do this within the first 60 days of drying off. And Finola mentioned there already about why many of the cases of mastitis that occur in the first 30 days after calving could be picked up during the dry period. I think that's always, it can be a hard concept to grasp, but that's why we're kind of mentioning it a couple of times. So to assess the drying off period, you need an early milk recording, which may mean all your cows might not be calved when you do your first milk recording, but which is, I know a lot of people might want to wait till all their cows are calved, but it's better to think of the bigger picture, and maybe do to split the recording to get as many of those cows that are calved early as possible. I mentioned that we have free consults that are available to farmers. The first one is the dry cow consult, which is open now until you can sign up until the end of November. If you meet those eligibility criteria, it's completed by a trained vet. They go through the records, assess your drying off routine and the environment, and identify the cows which may or may not need an antibiotic. And then for those who aren't reaching those eligibility criteria, we developed a new consult last year. Sometimes I know from when I was in practice, when farmers have a mastitis problem or high cell count problem, they could be hearing messages from different people and different messages from different people, and it gets very overwhelming and they don't know where to go. So the objective of this consult is that it's a first step into problem solving mastitis, but it involves a team approach, and this team is chosen by the farmer, and it will include the advisor, the milking machine technician, the co-op advisor, and they all work together with you, the farmer, to look at the areas, assess the routine, the environment and the records, and to develop an ongoing plan. You know, as I said, this consult's just the first step, but it is a first step, and it's free. It's 3 hours, so there aren't any eligibility criteria. So really, we would encourage you to sign up if it does appeal to you, or if you feel it would help you. There are the links there, or it's available on the website either. I might just pass over to Finola for these updates on the regulations. I know she's been very involved in liaising with the department on these. So
Thanks,
Finola.
Michelle. Thank you. Yeah, so just I suppose by way of explanation and update, as I mentioned already, there are new veterinary medicine regulations that have been in place. They've been law in Ireland since 2022. The regulation you might have heard referred to, it's called 2019-6, which means that it was brought in at European level in 2019, and then every member state has 3 years to, I suppose, get their house in order and prepare for the implementation of that regulation in their country. So since January 2022, it has been, I suppose, it has been law and it has been live within Ireland. And there's many elements within it, but I guess the real purpose behind this, and this is something that has come from a European level, but which is part of I suppose, a global conversation. And the whole purpose of this new veterinary medicine regulation is it's really focusing on trying to reduce the risk of antimicrobial resistance. So, as we're all aware, antimicrobial resistance happens when bacteria that used to be susceptible to a particular antibiotic no longer are. So they develop resistance genes. And what we have to, I suppose, understand and remember is that we don't live nor kind of exist in isolation. The connection between humans and animals and the environment in between is a continuum. So what happens within the animal world, if you like, can influence that within the human, and vice versa. So we know, and the science again would tell us that the antibiotic use in humans has contributed or is contributing to antimicrobial resistance in pathogens that affect humans, but also in pathogens that affect animals, and vice versa. And the way that can happen is through the transfer of these resistance genes. And even just to give, I suppose, to give a sense of how close these two worlds are, if we look, and this is information that comes from the World Health Organization, but 75% of new human pathogens that have emerged in the last 25 years, so for example, swine flu, avian flu, COVID, are zoonoses. In other words, they transfer from animals to humans. So they start as animal infections, and then they transfer to the human species. So it's what happens in one species, if you like, is so important and influential on the other. And the reality is we use many of the same antibiotics to treat both humans and animals. And what we're at a point where no new antibiotics are being created or are being discovered. So we really need to mind and protect the ones that we have, and try and make sure that no further, or that we can try and reduce the rate of antimicrobial resistance developing. Antimicrobial resistance, or AMR, is a natural process. And when Alexander Fleming discovered penicillin many, many years ago, he also, I suppose, forecast at that stage that if we abuse or overuse it, bacteria will become resistant. He could tell even at that stage that it was a likely phenomenon, or that it would happen. And that's exactly what we've seen over the years. So I suppose this is the real driver behind this European regulation, is to try and achieve more prudent and responsible use of the antibiotics, to try and minimize that risk of antimicrobials becoming resistant over time. Michelle, do you want to? I can't remember what's on the next slide.
Yeah, it's just our resource.
Okay, so I'll take a skip back then there for a second.
Okay.
But just even in terms of the antimicrobial use, as I've said already, there's a lot of discussion, and even within our CellCheck technical working group, we have debated at length around, I suppose, guidelines and recommendations in terms of, which animals are, for which animals is treatment justified at the end of lactation. And it's a really important conversation to have, and it's a really important discussion to have. But as I mentioned already, and as I said already, it's almost the next layer of detail. The foundation has to be in place to ensure that the decisions, I suppose, or the treatment strategies that we implement are going to be successful. Generally, what we see, and in most cases, and you may all have experienced this either through yourselves or through colleagues, is that if something like selective dry cow therapy, so in other words, only treating certain animals with antibiotic drying off, if that isn't successful on farm, it's generally not because the incorrect animals were selected for treatment. It usually comes back down to hygiene or dry cow management, or the kind of the fundamental of, the fundamental management practices and hygiene. It's not usually because we picked the wrong animals. Because worst case scenario, if we select the, if we incorrectly select the animals for treatment, the worst that would happen is we miss an opportunity to cure one. But we don't generally make things any worse. What does make things worse is if our hygiene at drying off, or our winter housing, or the dry cow management exposes those cows to a bacterial challenge that they can't defend. That's where the real problems stem from. I suppose a couple of the real focuses within that regulation, and these relate particularly to dry cow treatment decisions. One is that, and it clearly states, antibiotic can no longer be used prophylactically. So what prophylactic means is in a preventative way. So, and I mentioned it already, that we in the past would have clearly acknowledged. And if you look at the labels or the manufacturer's instructions with any of the dry cow therapies, they probably still currently say that the indications for the product are to treat cows that have mastitis infection at the end of lactation and to prevent new infections. Now, these regulations are requiring all of the manufacturers to change those data sheets, because that can no longer be an indication of the products. We are not at liberty to continue using those antibiotics to prevent new infections. We need management to do that, or we have to use our management for prevention. So the regulation says we can't use it preventatively. And the other point that the regulation makes, and the other article within it, is that antibiotic can't be used to compensate for poor husbandry, poor management or hygiene. So again, the things that we're talking about, we may sometimes feel, but I have to use it because A, B, and C. We can't use that excuse, if you like, anymore. We have to fix A, B, and C, so that we're not depending, or we're not using antibiotic to compensate or as our alternative. So what it means is, sorry,
Finola, I was just going to ask, is it being enforced? Like, I know we've heard farmers were worried about it last year, but mightn't have heard anything about it this year. What can they expect?
Yeah, so I think over time we're going to see more and more enforcement by the regulator. So the regulator is the Department of Agriculture. They have a responsibility. They have to report to Europe what's actually happening at ground level. And last year, I suppose last season, which was the first dry period in our seasonal systems, in the lifetime of this regulation, I suppose the position that the department took was that they were trying to encourage people to get moving, but they were, they recognized that there was probably a little bit of leeway required. They're tightening up that flexibility, if you like. So what's starting this year is the department are now, for this season, will now be commencing inspections. So inspections of the prescriber, in other words, of the vets and the vet clinic, looking at their records and looking to see what are their prescribing patterns. Are they still continuing to prescribe for the whole herd, or are they prescribing for individual animals and actually assessing the individual information available and making a decision, identifying the animals that need antibiotic treatment and working on that basis. And what they'll also be looking at is, if in situations where the prescriber or the vet feels that not giving antibiotic to all of the animals is too high risk from an animal welfare perspective. For example, if there aren't enough cubicles, or if the management isn't such that it can prevent new infection, and if they feel compelled to prescribe on that basis, I suppose the position of the department is, fair enough, that is your justification and you've documented that, but they will then, I suppose, follow up or look at the farm situation to see, well, have those reasons for requiring the antibiotic been addressed or resolved for the future? Because while they may excuse, if you like, allow it, in 1 year, it's not something that can continue indefinitely. They want to see change happening on farm as well that can enable the prescriber to prescribe selectively rather than feeling the need to prescribe for all animals, because they feel that the risk is too high. They will be requiring farmers to look at those risks and correct them over time. And I suppose some of the, and I still keep coming back to the point, the hygiene, the management is everything, and the selecting the animals that either require treatment or not is another level of detail. But nonetheless, it's still, I suppose, what people, what concerns people and what they maybe are maybe not so clear on sometimes. And as Michelle rightly said, it really is a conversation to have with your vet, because your vet will know your farm, will know the management, will know the cows, and will know the history of what they're working within. Having said that, in many cases, we're kind of starting with a blank page. And if we're not, there are rules of thumb, if you like. There's no perfect cutoff point for saying this animal needs antibiotic and this one doesn't. But there are guidelines and there are rules of thumb. And a reasonable rule of thumb, it may not be perfect and it may not necessarily be suitable for every farm, but a reasonable rule of thumb is if a cow hasn't had a milk recording over 100,000 this year, and if she hasn't had clinical mastitis this year, then there's no, I suppose, evidence or indication of infection. Therefore, she shouldn't need antibiotic, and she could be dried off with teat seal only. Now, as I say, it's a rule of thumb. It's not a regulation. It's not it's not hard and fast. And in some cases, with that conversation with your vet, I know there are lots of farmers that are working perhaps at a higher threshold. They're maybe using a cutoff of 150,000. Others are going lower than that. And there's no absolute right or wrong, but it's about trying to, starting somewhere and having, I suppose, a plan that you're comfortable with. And even particularly for if this is new to you this year, one of the things I would encourage, and I think the department would support this, is even to start on a smaller scale. So they would accept that, for example, if a herd of 100 cows, if 70 of them should really only be dried off with teat seal only, they would like to see perhaps in year one half of that number, so 30 or 35 getting teat seal only, and then next year let's do build it up to the 70, because it is about building up confidence as well as competence. They recognise that, I suppose, that challenge as well.
And that's something we will get asked Mella to go through, because she's been through this for the last number of years, and she has some kind of tips from how it went for her. So
great.
Might be a good time to bring Mella in if you're happy enough, Finola, or is there anything else you wanted to ask or add?
No, just that, I suppose, just that next slide there just maybe gives people a pointer towards some of the resources that are available. If you go onto the Animal Health Ireland website, there's a wealth of resources. There's a mixture of videos, information leaflets, articles, a whole myriad of things, and obviously the kind of the original Cell Check Farm Guidelines, which is quite a comprehensive manual for all of the lactation, or for all stages of the cow during lactation. But there are also a lot of resources dedicated to the drying off, to the winter management, milk recording, and so on. So have a dig around. I'd encourage it.
Thanks, Finola. And you're going to stay. Were you able to stay on for a bit? Yeah, great.
Yeah,
thanks.
I've only been gate crashed once, so
I'm
doing well in the hiding so far.
Thanks. It's not a great time of the day to have one of these calls when there are children in the house, so we appreciate you able to make the effort. And I know a lot of the people on the call probably have the same issue, but we'll keep going anyway, and we'll welcome Mella. I suppose to start off, Mella, will you introduce yourself and give us a bit of a background for anyone who's not familiar with your story?
Okay, hi. Mella Briscoe is my name. I'm living near Portumna in southeast Galway. I'm farming in partnership with my husband. He was always a dairy farmer, but I was a cattle and sheep person up until 2015 when I converted my block. So I'm, technically a new entrant, and that's the excuse I use when things go wrong. I'm still learning. Our two sons are farming with us as well. So there's a good team of us here. And between us all, we're not too bad. We do the best we can, but we don't tick all the boxes all the time by any estimation. I suppose I started the selective dry cow in 2017 because I was just amazed, when you do your milk recording, so many cows were so low somatic cell count that they didn't need an antibiotic. And I just felt it was criminal to give them antibiotics when they didn't need them. And that's what started my journey on it, and it's not about the lower cost. You don't use as many red or mastitis tubes for the cow, but it's about trying to do the right thing and trying to reduce your antibiotic use. But it takes planning and preparation, and And you know, you need to put a bit of effort into getting organized for it, you know. But look, I love data and I love that sort of stuff. So I love the ICBF site. So I like sorting out all that data to figure out which cows are eligible and which ones aren't.
Great, thanks, Mella. So I suppose I know we kind of broke down the drying off into before, during, or on the day and after, and what would you explain kind of what you do or how you approach it?
Okay, so I suppose we're doing our final milk recording now next Monday, okay? And when we get the results back for that, I'll sit in front of the laptop and I'll sort through the somatic cell profile on the ICBF site. And, you know, select cows. Now, what we call them green cows and red cows. The green cows are the ones that are just getting a sealer only, and the red cows are getting a sealer and antibiotic. So when I started in 2017, I found it hard to get, you know, good information about what parameters I should set for selecting on somatic cell. And the first year, I used an average of 150. But like, as they say about an average, your head is, you know, your average temperature, but your head might be in the fire and your arse could be in the freezer, you know. So you have to be very careful, you know, with the average. So I'd always make sure that, you know, there's a somatic cell, at least, you know, the 4 somatic cell results for each cow. If a cow has missed one, you know, I won't put her on the green list. If a cow has had any mastitis issues during the year, she won't be on the green list. If she's a cow that refuses to lie up in a cubicle and behave herself, she won't get one. If she's a scuttery cow that's always dirty, she's on the red list. So we say on the ICBF, you can select you know, what parameters you use. So you go just an example of the list from last year, okay? So you can set on the, you know, now it's important as well to put, you know, 1 to, we'll say 100 as your
filters.
Your filter, exactly. I'm not great at the IT stuff, but so the average for the year might be 100, but for every milk recording should have to be under 100 as well, okay? And that she would have had a result for every recording. So from 1 to 100. Now I've played around with the figures different years. In the beginning, I was, you know, 150 was the average. I've used 60 another year, but I've kind of settled now what Finola said. I'm, you know, an average for 100 and no reading over 100 for the entire year and no recordings of mastitis. Okay, so then when I'm happy with it, and then you'll go through and you see if there's anything else, you know, untoward about a certain cow, if she has, you know, a wart in her teat or whatever. So you'll select them out, and then when I've them selected, I call them my green cow list, okay? And then I print off the expected calving list, and I do it in date order. So the earliest calvers are at the top of the list, and then I go through that list with my highlighting pen and mark all the ones that are green, and that's my template then for the year for the drying off.
And
okay?
can I just ask, Mella, do you involve your vet at this stage, or I know you have done the dry coding?
So you can. So obviously, look, I love the data. I love all the sorts of myself. But for people who wouldn't be, you know, who wouldn't like, you know, maybe the computer or the ICBF, your vet will do all that for you. It's fantastic. You know, if you qualify for the consult, you know, you put the data up earlier about, you know, 4 milk recordings and under 200. Your vet will come out and do all that sorting for you for the first few years, you know, just to help you at it and to give you a bit of confidence. So no, I've done it myself, but then I would rather pass the vet when he come out for the consult as well. So then I have I put the heifers on a separate list because we'll be drying those off first, and then everybody else is on another list for drying off. Look, I have a lot of lists. My husband say I suffer from listeriosis because I'm constantly, you know, writing that list. But you know, I like to have it in front of me to know in the parlour to double check that this cow, is she green or red? Okay, so now that's one thing about, you know, the selective dry cow. It does complicate the job a bit. Like, let's be honest about it. You know, people think you're doing it to cost less, but it's not that. You know, it does complicate the job a bit as well. But this is our 6th year. This is our 7th year going to do it now, and to me, it's well worth it. Okay.
And sorry, Mella, just to interrupt. So you've been at it for that long, but can you remember back to when you were starting, how you felt, or would there be any advice you could give to people who might be starting it for the first time? I know you didn't always start with, you didn't do all, like you did less the first year.
Well, the first year I had a parameter of 100, less than or equal to 150 of an average, and under that, and I still had 48% of cows were green that year, you know.
Mhm.
So whether it was bravery or stupidity, I went ahead with that. You know, there's a very thin line between the two, but you know, it has worked. So you know, it has worked for us. But ultimately, the most important thing is hygiene. It just has to be. If you're putting a sealer into a cow with no antibiotic, it has to be like you're doing open heart surgery, or else you're just asking for trouble. And you know, you have to emphasize that to people, you know, that are helping out. There'll be 3 or 4 of us drying off our raw cows, you know, and it helps if you have an independent person out of the family to act as a referee, because you know your teenagers mightn't really get how important it is to have everything so scrupulously clean, and you get a lot of rolling eyes to heaven and sort of that when you're, you know, trying to get this attention to detail. It's so important, you know.
Do you want to describe your routine? I know it's
okay, so on the morning, milk the cows. Now we have a drafting machine since 2017 or 18, and that's not for the cows, that's for yourself, you know. Because you know, the first few years that I was drying up cows with my husband, I thought to get a heart attack hopping in and out of the pit and moving gates and everything. I know they're expensive, but God, they're a great investment in yourself. So the night before, I've drawn up the list that who's going to be dried off the next day. Now, heifers will be first. All the heifers get 3 months off, and the cows get 2 months off. And if there's a thin cow or a cow, maybe bad feet, that needs a break, she gets the 3 months off as well. So I have my list the night before of who's been dried off. You might do green cows one day and maybe red cows another day, depending on how the numbers stack up. So milk the cows, draft them out of milking, have the breakfast, and come back in then and start our drying off. Cows up on the platform. Now we have a 24 unit, we might put maybe 6 or 8 in at a time, okay? Not to have them too long standing. And then one person, now we use baby wipes, you know, soaked in methylated spirits. Now you were saying before, this it's surgical we should be using, and I did the meth spot for this already, but I'll take that on board for next year. And so now tails clipped, try to have them on a fairly dry diet, that the dungs are relatively solid, and the freeze bands clipped as well, because it's so important to have the right, you know, you have to have the right cow. You know, it's not so bad if you give a red tube to a green cow, but you don't want a red cow going through and only getting a sealer. So it's very important to have all the clipping done beforehand. So one person will go along with the baby wipe and the first round of cleaning, and then there'll be a second one, somebody with the headlamp on that can actually, you know, get into the top of the teat and actually get it, practically scrub it, okay? And then the next person's job then is to put in say if it's a red cow day, so they'll have to put in the antibiotic tube first and then the sealer afterwards. And then when those 8 or 6 or 8 or whatever are done, somebody goes behind them and we dip them. Now we have a sprayer in the pit, but we actually just dip them. We put fresh teeth spray into a cup and just dip maybe twice. You might do them all twice, you know, before they go out. And then record, you know, I'm recording that as we go along. So now you leave out all the tubes before you start the row. You leave out all the tubes behind you, so that you know that each cow has gotten her allocated tubes, you know, so there's no gray area, did she get it or not? So put in the tubes and dip them, and then leave them standing for as long as you can afterwards. Now, ideally, if the weather's dry, we could let them off to a paddock for a couple of days if we could. I don't see that happening this year now, because there's another tsunami coming tomorrow, I think.
Yes,
so, or else, if we can at all, move them away from the milking parlour. Okay, so for the first few rounds of cows, we have accommodation away from the milking machine that we can move them out of the way there. And after that, then it's just keeping the cubicles clean and the line topped up, you know. We'll do, like last year, just looking, we dried off on 9 different days last year. You know, we just do it, you know, as they come eligible to be dried off. And just
You're never
keeping
doing too many at one time. Then.
Yes, exactly. So it's not a too big a job. Now look at, come to the middle of December, you could be probably doing too many at the one time. When you want to hurry it up to get it dried off or stuff. So we're far from perfect,
Mhm.
And I do find that if you are going to have, the first milking the first recording post calving, if you are going to have cows that have gone up in their somatic cell, it's going to be the ones you dried off in December, because you're gone that farther away from the milk recording results as well, So and you're not possibly you're not as good or as enthusiastic about it when it's 2 weeks before Christmas.
Yes.
But that's roughly what we do now, It's not perfect, but it's working okay for us so far. And I suppose in the beginning when we started off, with a very young herd, with a lot of heifers and stuff, and I think our somatic cell was around 78 then. It's gone up and down between 78 and 130 different years. So we're averaging around, last year we were 130, around 130 again this year, but our herd has matured a good bit. If it stays around the 130, I'm happy with that. And still be able to keep up with the selective dry cow.
I might ask Finola to come in on that actually, because I know it's something that we do hear sometimes with selective, that the cell count might go up initially after calving. Is that something they should be worried about, Finola?
It's something to watch and be aware of, and that's where the records are really important. If you think about it, it wouldn't be surprising if we had a small increase in somatic cell count in the in the early lactation, because when cows, the bacteria that cause mastitis in cows can be what we call major or minor pathogens. The major ones are the ones like Staph aureus, Strep uberis, E. coli, the ones that we're all familiar with that cause either sick cows or ongoing problems or, clinical cases. But we also have groups of what we call minor pathogens, and we kind of tend to clump those together. One of the kind of the families, if you like, of bacteria that are minor are what we call the non-aureus staph. So they're also staphylococci, but they're the ones that live on the skin or on the teat skin or kind of inside the legs. They're common. They're there, and they're like ourselves having staph up our noses and in our mouths. They're quite normal, if you like. And they can colonize, particularly in the early lactation, and particularly we actually see them very commonly in first lactation animals when they calve down. So if you can imagine, if we're not giving every animal antibiotic, we're not going to be wiping out all of those minor pathogens as well. So you are going to get some, cases where the minor pathogens have colonized, but the cow's immune system deals with it. It's not, I suppose, in most cases, they're not really enough to kind of justify, use an antibiotic to prevent them, because they're minor. The cow's immune system deals with it, and end of story. And as I say, they're very often what we see in first lactation animals as well. So it's, I suppose, and again, that comes back to having the records and really being able to kind of interrogate, did we just kind of see a small lift, or did we actually see spikes or, kind of dramatic problems, and been able to tease out the difference. And also, if we are seeing, for example, clinical cases, and it's something that, that we would always really encourage, if there are clinical cases, either at calving or especially in the early lactation, just taking a sample of that milk before we use any treatments, label it, put it in the freezer and forget about it. And then if we look back over, we'd say 2 or 3 weeks and realize, geekers, I had more cases that I'm happy with. Or I had cases, perhaps most of my cases were in the first lactation animals that, and need to understand why. Then there's a really valuable bank of data sitting in a freezer that can still be sent to the lab. So samples can be frozen for 3 months, and it'll have no effect on almost all of the pathogens. The only pathogen that doesn't survive freezing particularly, well, it's not that it doesn't survive, the only one that's a bit susceptible to freezing in terms of damaging it are E. coli. But the reality is, it's very hard to get an E. coli to culture it. They usually peak and pass so quickly that we often don't get them to send, to culture anyway. So I wouldn't worry, that's, I suppose, a little bit academic. I wouldn't worry too much about it. We can keep samples for 3 months, and more generally speaking, they're as representative as the day that we took them.
Can I just ask, so if people are taking samples, should they be cleaning the teats, or what kind of procedure should they be doing?
Absolutely the same thing. I mean, the same, I suppose, okay, it's not as detrimental to the cow in terms of needing the same level of sterility. But if we get contaminating bacteria, if we get bits of dust or hair or dung flicked into a sample of milk, that's what will grow on the plate. And unfortunately, the lab won't be able to tell that you've had a contaminated sample or that you've sent in a contaminated sample of milk until they've incurred all of the cost of culturing it. And then you get a result back to say mixed growth, inconclusive, can't tell anything because it was contaminated. So it's really important using the same, ideally using the same level of sterility as Mella's describing there in terms of putting something into the quarter. We should have the same level of sterility when we're trying to get something pure out of the quarter. So, clean gloves, sterile bottle, sterilizing the teat end, and taking your sample, ideally holding your bottle at a 45-degree angle and squirting sideways. And the reason for that is that if dust falls down, it's not going to fall straight in on top of the milk. You won't get a full bottle, but you don't need a full bottle. The lab only needs a couple of mil, to work with. So you don't need to fill it right up to the top. So, it's like pouring a pint, keep it on the side and you'll never be able to pour it right up to the top, but that's okay. It doesn't matter.
Yeah. That's actually the mistake we made the first year we sent off samples to the lab, and they came back inconclusive. And in fairness, when I got in touch with the girl in the lab, she was absolutely brilliant. She gave me so much practical advice and about how to do it. And yes, you have to be absolutely as clinical as if you were drying off a cow. And no, we've been better other years for taking samples for the lab, but I always found that they came back recommending the same antibiotics. So the routinely the same tubes every year were recommended, or a brand of them. Do you know what I mean? A range of them. So I haven't done it. I haven't sent off samples down the last couple of years. Yeah. But the lady in the lab was excellent. She was very, very, very helpful, practical help on how to get it.
Yeah.
But the one thing I suppose that we need to do more is that the heifers in the springtime. Every year we'll have a heifer who has a bad case of mastitis, and despite the best efforts, will lose a quarter. So definitely that's on my list for this year. Every heifer that gets a case of mastitis in the springtime, I'm going to freeze those samples and find out exactly what's causing it. Okay,
that's and that's a really good strategy to have. And I suppose what I would add is it's probably not surprising that the lab comes back with more or less the same answers each time in terms of treatments, because there's a limited number of treatments that are possible. The market doesn't change all that much.
Yeah.
The two things that those samples are really valuable for, firstly, is identifying any resistance. So telling us what we shouldn't use, because that's the thing that could change over time. Yeah. And knowing what's useless is as important as knowing what might work. Because we also have to be realistic. What the lab can identify as a suitable antibiotic is based on almost the perfect world. A plate of bacteria and the antibiotic goes straight onto it. Does it kill it or not? The reality is the cow's udder is not the perfect world. So just because it works on the plate in the lab also isn't a guarantee of cure. This goes back to the cure rates. There are factors such as the quantity of milk, the size of the udder, whether there's scar tissue, how long it's been in there, all these various things. So it's a good it's an indication in terms of treatment choices, but identifying resistance is where it's most valuable. But the other thing is building an understanding or a bank of data in understanding where are those infections coming from. Do I have the type of infection that's passing from cow to cow to cow, or do I have the type of infection that's coming from the environment? Because how we deal with those then is slightly different. It's quite different. And sometimes you might have a bit of both, but it's as much about understanding what bugs are my cows being challenged with, because then that helps me understand if I want to prevent this for other cows, where's the best place for me to put my efforts into to get the best return. And even in terms of the heifers, that's something really good to do, is take samples, and keep those. Not necessarily because it's going to change what you do with those heifers this year, but it might change what you do with your heifers next year to make sure that it doesn't become, it's not an annual cycle.
Yes. So when we were expanding, like a lot of people, we hadn't enough cubicles for the heifers. So they were on slats. And last year was the first year we had, 22 was the first year we had, a cubicle for everybody in the house. But still, we got a couple of cases of mastitis in the heifers, which was kind of disappointed with, But anyway, it's our next mission to try and find out what's behind all that.
And yeah, absolutely. And the first kind of step in trying to improve these situations is understanding where it's coming from or what's driving it. So what I would suggest even in that situation is sampling the ones that have clinical mastitis, but also using your records to identify not just the clinical cases, but the ones that calve down with a high cell count. Because you could label those as also a problem case, and also the ones that might have a blind quarter, because they would be considered abnormal, if you like, or possibly the result of infection. And by the time you add up those 3 categories, then we have a truer measure, if you like, of the quantity of infection within the heifer batch. Because, you know, it's not just, they're all variations, if you like, of possible infection.
Okay.
We're kind of coming near enough the end, so we might take a few questions there, and that's great discussion, because I was going to ask Finola actually, how many samples do people need to take, you know, if they have, say, 100 cows, what kind of numbers? And you've already described that you need to take a selection of cows, but is there a figure or?
Yeah, if you were doing an investigation or trying to get a kind of a sort of an overview of the herd challenges, really you need at least a dozen samples, because chances are you won't grow anything from 2 or 3 of them, because we may not actually get enough bacteria in that sample for it to grow in the lab. So allowing for, you know, for some of that wastage, if you like, ideally about a dozen samples, and within that a mixture of cases. So don't just take all of the old cows that have had a high cell count all year, because we can almost predict from a distance what they're likely to be. Make sure there's a mixture of young and old animals, and also a mixture of those that might have had a cell count, you know, perhaps 2 or maybe 3 recordings in a row, but also some of those that only had a high cell count on the most recent recording. So in other words, they're recent or new infections as opposed to the chronic ones. So you're getting a good, you know, a kind of a licorice all sorts of what's happening within the herd, to give you a reasonable confidence that we know what all the challenges are.
Okay, so one question that's in there is about sealing in calf heifers, and I suppose it comes back to Mella's point there with some couple of her heifers calving down with mastitis. What is the advice on sealing heifers?
On sealing heifers? Yeah,
before they calve.
Okay. So I suppose I start off with the caveat and the health warning. So the reality is that using teat seal is not a licensed use of the product in Ireland. It's different in New Zealand. They have a different label claim. But in Ireland, it's only licensed for use in cows at the end of their lactation, to give you the detail. Now, it's a little bit of a grey area because it's not a prescription product. We're not quite sure what the kind of the regulators' view on this is, but that's the reality, is that it's not licensed use. However, I know many people do it, and I guess there are pros and cons to it and things that we need to consider. So the studies from other countries, particularly New Zealand, where a lot of the work was done, where a lot of the early research was done, is that sealing heifers is a very effective way of reducing intramammary infections after calving. Generally, it's done sort of 3 to 4 weeks before calving, when the teat canals start to open, but it's not without risk both for the animal and for the operator. And you know, there are some, I suppose we also hear some reports, you know, or kind of talk to people that are perhaps somewhat surprised to find that when they try and seal the heifers maybe 3 or 4 weeks before calving, that they can't get the seal in or they can't get the tube in, which is inevitable and not surprising, because in some heifers the teat canals won't necessarily be patent or fully developed. So you have to take every animal as an individual. They're not all going to be identical or in the same kind of the same situation. Obviously, again, and as Mella has outlined for the drying off, sterility is absolutely essential. I mean, if you consider that quarter is a sterile unit, until such time as that teat canal opens for the first time, nothing has ever been in there. And here we are considering infusing something into that quarter. You know, the risk of infusing or introducing bacteria is huge. Not to mention, as I say, the potential kind of physical damage that we can do if the heifer is not sufficiently developed, and also the operator risk, you know, in terms of handling those animals. I would also add, and what I would say is, you know, as I say, the research has shown it is very effective, and that's why, you know, going back to what I was advising to Mella there in terms of actually understanding the level of infection within our heifers, we should look at blind quarters, high SCCs, and clinical cases and count all of them, because that gives us an indication of the prevalence. If we have over 15% of heifers affected in any of those, by the time we consider all those categories, and that would be considered, that's higher than our target. That's more than would be kind of tolerated or acceptable, if you like. But there are other strategies that work as well. And again, the data would support that they're as effective in reducing those intramammary infections. And one of them being teat disinfectant, just with the regular disinfectant that we would normally use in the parlour, doing it on a weekly basis or even twice a week for the last 3 to 4 weeks before calving, which in an Irish situation where we generally have our animals at home, they're generally on the home farm. Very often we're training them into the parlour, maybe with feed or not, but we're kind of often doing training in those last few weeks before calving down. It's very feasible to also do a teat spray or a teat dip, which might be a little bit more difficult, but they also get used to it pretty quickly. But in terms of the handling, using a teat disinfectant will actually achieve the same thing with a lot less risk and problem. There's also, I think in the last year or two, a new product that has come out onto the market. I haven't seen any of the data behind it yet, but I can understand, or I'm optimistic that the principle should be effective, and that's an external teat barrier. So I suppose it would work in the same way, or we apply it in the same way. And talking to the distributors of the product, even just over the weekend, the feedback that they're getting is that farmers that are using it predominantly in their heifers, and they're using it at that time when they're walking through the parlour, when they're coming to the parlour for training. It basically goes, it's kind of like, I suppose it's kind of like a nail varnish that just stays on the end of the teat, on the end of the teat, applied with a dip cup the same way as a disinfectant would be. But it's stickier than the traditional external barriers, but it does flake off and disintegrate after about 5 days. But it actually creates a physical barrier. And as I say, I have not seen data, in terms of its effect or its relationship with intramammary infections. But in principle, if we can, in a safe, sterile way, if we can keep that door shut on the teat, it should be a good thing. And something like this could be perhaps an easier, or in some situations a safer way than the teat seal per se.
Great, thanks. Another question there, in relation to fluctuating cell counts, and you touched on it earlier with Staph aureus. Maybe could you explain why cell counts might fluctuate during the season, or even in the bug tank towards the end of lactation? Why does it tend to go up?
Okay, so fluctuating cell count, fluctuating bug tank cell count is a reflection of the individual animals that are contributing to it. And at certain times, some of them are having a greater influence than others. And those fluctuations could be because of clinical cases, or they could be because of subclinical, so no signs, but chronically infected animals. And those particular animals at an individual level also fluctuate. So what they've seen in a kind of an academic situation, if they have animals that they know are chronically infected, and one of the biggest culprits is Staph aureus, because it tends to evade effective treatment and remain in I suppose there's a couple of things that it does. Firstly, it produces biofilm, which protects it from antibiotic. So it's not specifically an antibiotic resistance, it's just characteristics of the bacteria that help it avoid the antibiotic in the first place. It has a biofilm, kind of like a slime around it, so that the antibiotic can't get to it. Secondly, it creates, it develops small microabscesses within the udder. So again, kind of like an onion, it has layers and layers of scar tissue around it, which also offers protection. And when the Staph aureus is kind of active active within the udder, that triggers the immune system and the somatic cell count rises. And that immune system or treatment can deal with those bacteria that are accessible or circulating, if you like. But then some of those bacteria develop their dormant residency, if you like, and develop small pockets where they can just hang out. And because they're not triggering the immune system, the somatic cell count can drop down again to pretty normal. Then some of those microabscesses might burst, releasing some of the bacteria, triggering another immune response. Somatic cell count can shoot up again. So it's why these animals are potentially continually contagious, because they don't shed all the time, but they shed frequently and not consistently necessarily, but they're never, we can never say they're not shedding. If they're chronically infected, they still have the bacteria in some locations within the udder. It's also why they can be really difficult to treat, to get a complete bacterial cure. We may improve the clinical signs, we may see the somatic cell count drop, but in a lot of cases, and this comes back to the 20 to 50% cure rate, we're only kind of clearing what's in the main area, and we haven't got what's hiding up in the wings. The reason we get a better cure rate at the dry period is not the quantity of antibiotic, but the duration of its presence. So the fact that it's there for a longer period of time, and the formulation of the dry cow antibiotic allows that, so it persists for longer. It's not, in the past I've heard some theories or hope strategies, if you like, that maybe that in the past some people might have done double tubing or used two dry cow tubes, two cheaper dry cow tubes in a chronically infected cow, thinking that might help get a better cure rate, when the reality is to maximize the chances of cure, you'll be better to use a dry cow tube with a longer action rather than quantity. So it's the duration of action, not the quantity, that makes the difference. So that's why the dry period is more effective in terms of cure rates, because it can just hang in there for longer.
But I suppose it's worth to mention that not every cow is curable, and
Absolutely. Yeah.
if it had gotten a dry cow treatment last year and there was still a problem this year.
Yeah. I mean, if an animal, and again, this, these are the I suppose the discussions to have using both your records and discussing with your vet. There are some cases that we just have to, we have to draw a line under, and particularly if they've had a dry period before, and if they've had, I suppose a long-acting, particularly a long-acting dry cow antibiotic. Well, then, just doing the same thing again and expecting a different outcome, I believe, is Einstein's definition of insanity. No, but and I'm not being dismissive, but like the reality is there comes a point where some animals we're just not going to cure, and if you have given them a long-acting, a long-acting dry cow tube previously and it didn't achieve success, then it's unlikely to ever. So sometimes we have to make a call on some of those.
Okay, I think we might have just time for one more, and it's about the practicalities, I suppose it was touched on briefly, of reducing milk yield, or should you go to once a day, or do you dry off abruptly, or what's the best advice? Or
in terms of so the recommendation is abrupt dry off, so just stopping milking. In our systems, sometimes I suppose the guidelines in some of the North American or the European in systems where production levels are much high, are significantly higher. They do approach this slightly differently in that they may alternate, or they may start to gradually reduce the milkings. But in our systems, the guideline is to just dry off abruptly, so stopping milking. Don't skip milkings. Don't necessarily even reduce to once a day. But again, some of this, I guess, is guided by people's experience, because I know some farmers that reduce to once a day, and as long as they're closely monitoring their bulk tank cell count, and that's the important thing. I mean, any changes that we make, there's generally something that we can use as a measure to see, was it the right thing to do or not? And some of this comes down to experience. I'd be interested to hear what Mella does.
Well, of course, the milk recording data will tell you exactly what they're milking as well. So that's a great tool as well to use. Yeah. But then there's cows that are nearly due to be dried off and they're milking too much. So you have to be very careful with them as well. Yeah. You might leave them a bit longer, depending if they have too much, because they'll possibly, they'll find it very hard to seal up. They'll be leaking on the cubicles and stuff.
Yeah.
But no, we don't do once a day. We just dry them off abruptly.
Yeah. And for those, sorry, I was just going to add, for those, I mean, you're absolutely right. There will always be some cows that, that are, we'll say, over the average, or kind of higher producers. And again, your approach of having, knowing in advance the time you're aiming for in terms of drying off, if necessary, for example, their feed could be adjusted a week or so beforehand to try and moderate that somewhat. What we would always recommend, though, is if we're doing any kind of nutritional adjustment, it's the feed only and it's not water. So we never, they must always have free access to water on welfare grounds. It's not a way to kind of lower production in preparation for drying off, but feed could be adjusted if.
Yeah, but it's very important not to overdo the feed thing, after drying off, because, remember years ago when people were drying off sheep and they thought they had carte blanche to free, to starve them for 2 weeks in a paddock. To be very careful not to overdo. I think, in the beginning, we overdid the drying off diet as well. You have to be you have to look at the whole picture. You can't overdo it either. They have to be fed.
Yeah, absolutely. And I mean, it's kind of minor tweaking rather
Yes.
than, you know, dramatic changes.
Yeah.
Because even, you know, at that stage in the lactation, minor tweaking will do enough just to, you know, to get them to the right place. And again, even, you know, doing some of those tweaks a week before you're going to dry them off will make all the difference, rather than kind of panicking the day, you know, not panicking, but thinking the day before, how am I going to suddenly drop this level?
Super. I think we might have picked your brains enough for this hour of the evening. I think Kira's going to give a little bit of an overview of the conferences coming up. I just want to thank both of you tremendously for your input. It was great. I hope everyone learned something from this evening, and I'll just ask Kira to go through what's the plan for the next conference before we finish up, please.
Hi everybody, and thank you so much for your time this evening. Michelle, Finola and Mella, it was brilliant. It's always great to get you think you know all these things and you go back and you get a great refresher. I always think you can never do too many of these revision courses. So just to let everybody know, so we have our save the date has kind of been sent out. So our annual conference is taking place on November 25th. So this year it is taking place in the beautiful Killashee Hotel in County Kildare. So it's on Saturday, November the 25th. And we'll be kicking off from about 9:15 up until I think it's about 4:30 p.m. So our theme for this year is cultivating health and success. So our website is just about to go live. We're working away at it here in the background. There's just a couple of changes to be made to it. But if you want to make note of that link, so it's www.eventcreate.com/e/Dairy Women Ireland Conference. It will be easier in the next couple of weeks, I promise. But that is the link to follow to, first of all, to renew your membership. So those of you who are here tonight, you're all members, you know, as of last year. So that membership is up, so it's kind of up as of now. So if you need to renew your membership for next year, but also you can get your conference ticket in a beautiful package, excuse you, for about €95. So sorry. So that's kind of the main piece to look forward to, is that's going to be going live in probably tomorrow. So you're getting exclusive access to that at the moment. I will be posting that across our social media channels, so you'll be able to book your tickets. I will say last year tickets sold out within about 48 hours. We are going to a bigger venue again this year to accommodate that, so there is demand. So tell your friends, tell your sisters, tell your cousins, tell your mom, tell everybody.
What kind of topics will you be covering?
What topics are we covering? So there's a host of topics here. Bear with me 1 second. So we have, here's one I prepared earlier. So we are talking about strategically developing your role to fulfill your goals. So that's a really interesting piece about how you can carve your own role on your own farm business, regardless of kind of what your background is coming in from. So that is a mixture of, you know, that's being chaired by Aidan Brennan. And then we have some local dairy farmers then as panelists. And then we have flexing your accounting and policy options for your dairy business. And that is with the brilliant Barry Murphy from FDC. And then after quite a short break, then we have the fabulous pharmacist, if you know Laura Dowling. So she'll be doing a piece on kind of how to stay healthy, looking after your own health, not just our cow's health, which sometimes we're all too guilty of. After lunch, so lunch this year is a seated buffet option. And then in the same way that last year, some of you might remember, we did breakout room sessions whereby everybody selected a breakout room. And again, those are be going into more detail. So the 4 options on that is Michelle is going to continue on with the antimicrobial resistance, kind of the silent pandemic. So it'll be touching on, I suppose, going into more detail about what we touched on earlier, just in terms of antimicrobial resistance, which is something that we have to become much more aware of, and what we're doing on farm and how that links in towards human health. The second session then is myself and Mella, so we'll be talking about, so you married into a dairy farm, now what? And that'll just look at how you can kind of, I suppose, balance your own life, your relationship. Is a really delicate work-life relationship balance, so we'll just be talking about kind of tips and tricks to keep the ship sailing. So then there's family farm succession. So again, that's what Aisling Meehan, who is an agricultural solicitor, and that'll be chaired then as well with Anne-Marie Donaghy, who is in Dairy Women Ireland. And then the last session option then is Create the Life You Deserve, and that's with Sarah Murphy, who's a life and empowerment coach. So we've a little bit of something for everybody. There's a really nice mix kind of between the technical and between, you know, something slightly lighter. So again, when you are going through your registration page, just do make sure that you select your preferred option, and then you give us an option too, because we'll have to split people depending on room availability. But it's shaping up to be an absolutely brilliant day, and the venue is fabulous. So we're really looking forward to it.
Thanks, Ciara, and I know there's Trojan work going on behind the scenes, and thanks to everyone who's involved. And just finally, I suppose there's a final Zoom of the year in December. I'm not sure if you want to speak to this, or does the slide say it all? I'm sure everyone's aware of the beautiful yogurt from Cologne in Wexford, and it's the history of this yogurt. I guess it's one farm, one family, but there are 9 generations. So I think that'll be very interesting, and that's on in December. I think we'll need to wrap it up or come to our time. Hopefully everyone found it useful. I think it is recorded, so it will be available somewhere. I'm not sure where, but it will be available. We hope we'll see you at the conference, and best of luck. I guess if any of you have any questions that we didn't answer, you're welcome to email me or Finola at the Animal Health Ireland website or address, sorry. And best of luck. Thanks again to Mella and Finola and Ciara, and have a good evening. Bye-bye.
Bye. Thank you.
Bye.